Welcome to Optonome CEO Corner. I'm your host, Dennis Dicker. Let's get started, shall we? There was a recent update to the iPhone and iPad Optonome application. Please update as soon as possible if you have not. Some of the updates include turning on and off public channels so you can actually invite people to a team or a channel and turn on it or off their public channels, such as an employee. If you just want them to have exclusive access to your business, you can do that now. Other than that, there are other great features that I have gone over or will go over. So let's get started. In home healthcare news, former CMS administrator predicts dire near-term outlook for the home healthcare industry. Let's take a look. The former U.S. Centers for Medicare and Medicaid Services Administrator Seema Verma did not paint a rosy outlook for the home healthcare industry this week in Chicago. In fact, hardly any of what she said evoked optimism among operators in the crowd. In regards to the economy, she said it would be her guess that a recession is around the corner, though she acknowledged it was not her job to forecast such things. In terms of legislation being passed in Washington, D.C. this year, perhaps even favorable home-based care legislation, she said she didn't see it happening. And when it came to the home health nitty-gritty and last week's proposed rule, she told providers to expect a rebut to be an uphill battle. She did offer perspective on how the rule is determined, pointing to the fact that as of right now, operators can aim their ire at the system, but not necessarily CMS as a whole of of the individuals that currently make up the administration. I think in this case, and in every case, they're looking at the myopically at it very myopically, right? Verma said at Lincoln Healthcare Home Care Innovation and Investment Conference Wednesday. What is to say they're looking at the cost reports or looking at what the data says? CMS released its fiscal year 2023 home health proposed payment rule last Friday, which included a decrease to payment rates by 4.2% or 810 million less than compared to 2022 rates. And for everyone, this is for Medicare type services. This is not for home and community based services. In other headlines, the stability of home healthcare is at risk, like recently said. They're also saying that home health stakeholders weigh in on industry tailspin following proposed payment rule. Right? Novaleap CEO is saying hospital at home to have big ripple effects in home care. Home health providers are training staff to improve patient survey scores. First Light Home Care names new CEO. Dispatch Health hires new leader. How Accenture Care, VNA Health Group are acting on their value-based care strategies. Let's take a look at their value-based strategies. As more home healthcare providers move into value-based care space, these organizations are engaging on multiple fronts in order to ensure success. Providers such as VNA Health Group and Accent Care, in particular, exemplify the moves companies are making to support their value-based care strategies. In its broadest definition, value-based care means outcomes over costs. Like I was saying in the past, it's hard to actually afford value-based care because you're trying to offer more value to your actual client, and in some cases it could lower your profit margins. Moving on, at Accent Care, embracing a wider view of value-based care has become increasingly important. Right? I like to think of it as more a holistic setting. That's some of my family medicine training coming out, really looking at outcomes, but with some modifiers per se for clinical quality and excellence and experience from the patient side, our clinician side, our employee side, as well as from our family side. Really looking at the total cost of care beyond the short period of time that we're their caregiver. Accent Care, a Dallas based provider of home health, hospice, and personal care services, is saying the same. As a home healthcare agency, I think there's a few places where we've been able to be successful. A very important component, a very important utility within our health system partners, bundle payments, accountable care, and risk models that we focused on is how to make sure that we align what we do in a way that supports their value based initiatives. All right. Another provider, New Jersey based provider, is saying we spend a lot of time thinking about how do we do that in a way where we don't get used and abused. All right. Noting that home health providers are sometimes viewed as kind of a widget other than a valued partner. In terms of revenues from some type of bonus payment or cap payment is less than 1%, they said. In terms of activities that are organized under the broader construct, they're saying that um, about 70% is what's being paid. I'll look into that. They're saying that they're really being engaged in value-based arrangements, whether it's bundled payments for care improvement, because CMS is starting to give different types of bundled payment options for providers that they can really offer value-based care. All right. So it goes on and talk about, I think that they really create a more value oriented fee for service system by putting in what they're, um, it looks like they're making some progress on. In any other news, I'm seeing home health providers and home health value based payments demo states struggle to achieve financial upside. And again, back to what I was saying, when you're offering value based care, your profits lower. That's why on your administrative side, you want to be as efficient as possible so you can afford value based care. In Anchor News, a life of inclusion more than just an outing. The Centers for Medicaid and Medicare Services instructs states to consider whether service provision results in people having limited opportunities for interaction with members of the broader community. Limited opportunities can mean opportunities that are few in number, but can also refer to the limited nature of opportunities, even if they are plentiful in number. Providing meaningful day services isn't just about getting people out of the building. It's about actively supporting people to explore, connect, and contribute to their communities. When done well, meaningful day services create pathways to employment, greater independence, belonging, and lasting relationships. Giving this context, there's a webinar that is available that you can watch through Anchor. I've talked about this on many occasions, helping people um, be more involved in their local communities. And with the autonomy application, we're building out those opportunities by helping people engage with businesses that are looking for people to employ, being able to set up events and activities at those businesses and parks and different types of locations Just in the recent months, we've added the ability to allow people to create events and activities on the fly where anyone in the general public can now participate. And this is really helping people get more than just a regular outing, be able to engage with people, and if needed, share their um, behavioral needs with DSPs to intervene at specific times and locations when and where needed. In other anchor news, from June 20th, competing congressional priorities leave little room for budget reconciliation legislation. On June 20th, more than 400 providers and provider associations asked Senate leadership to support HCBS funding. Were you one of them? Legislation to end the use of electric shock devices advances in Congress. Let's see if there's anything else. The Department of Labor provides guidance on sub-minimum wages for workers with disabilities. FDA authorizes COVID-19 vaccines for children under 18. And I do believe Roe versus Wade was overturned. So there's tons of news as of today. Um, we'll continue to share any other progress. Within your state, there are administrative codes. Administrative codes include the regulations of which you should follow. We're adding more states every week. You're currently looking at Ohio, and there are many other states added. You could simply search the state or administrative code or something similar. I would first search the state to see what's available for your particular state. You'll soon be able to search the actual text within the regulations. So, for example, if you want to find information related to beds or room size or payment information or room and board information or incidents, you'll be able to search by text the entire manual or regulation requirements for service delivery. All right. Within your team, you now have access to your policies and procedures. All right. If you don't have a policy and procedure channel, please create one. The policy and procedure channel should be a place where you can take notes. You could um, document with your just for yourself or invite others to that channel. But it could be a way you can view the policies and procedures and test them out within that channel. To do that, you simply go to your team settings and access the policies and procedures from there. You do that by going to the forms and then accessing the form packages. The form package is a package of policies and procedures that were assigned to your team where you can further make edits to your liking. Don't go too far off to your liking because these policies and procedures should align with the regulations in order to provide service delivery. So if you take anything out or edit it, you could be liable down the line. All right. If you have any questions related to the actual policy, you can simply mention Optonome in that channel. Again, you must invite Optonome to that channel first, then mention them. Then you can ask any questions and we should be able to answer them. All right. Within your forms, you have tabs where you can search for forms completed or policies completed, or you could view additional policies and add your logo or anything um, customizable to your business, such as services and things like that. Within each form, you can drag and drop to move the different input fields to customize your policies and procedures. All right. You can add links to third party websites. You can add images. You can add videos to your policies. Again, it could be an introduction of your mission and vision. Then the description of services all in the same form, where you can have a requirement that they watch the video and then read the description of services and then sign off. You can customize it like that. All right. In addition, your policies and procedures can be further shared with your staff. Once assigned to specific channels, they can be viewed by different staff where they can sign off as part of their on-site orientation, as part of their ongoing training requirements, once added to the calendar. All right. In the next review, we'll be adding the different policies or forms to calendars. But what you can do for now is you can assign these forms or policies to different channels, have a requirement for staff to complete, and you can receive a notification when they complete it. It can be as simple as a push notification to your phone if you have the mobile application installed. Other than that, it could be an email or anything along those lines. And please be sure to check out the websites that we're adding to the Optonome.com website. You can check out those that are up and running. Please give them feedback and update yours as well. In today's world, content is king. We want to have a website and be active on social media. Through the years, I've been showing you how to stay current through social media by easily being able to record yourself online on the fly. By being able to record yourself, you're able to scale your content. Now, with digital advertising and social media, you can do everything from your phone. And you can repurpose content as well. The strategy is called jab, jab, right hook. Over time, you give content that people like instead of pushing content in front of their face that they don't like. By giving them jabs, it's content that they do want to hear, where a right hook could be a sales call or something along those lines. But you want to continue to give jabs to the public so they know that you're out there and you're giving content that they can use. Good luck, everybody. Have a good weekend. Thanks for watching, everybody.